The Vice Chair of Medicine for Lehigh Valley Hospital Hazleton, Dr. Jody Lenko, talks with our Lisa Sugart about the Omicron variant of COVID-19 and more in today's news feature.
The Omicron variant is another strain of the COVID-19 virus. It's the newest one that many of you have already heard about. It originally was noticed in South Africa. Quickly spread, so that was why one of the reasons why it's come to press so quickly is because of how quickly it spreads. So within a couple days of notifying that they found it in South Africa, it was also found in China. And then quickly across into Europe and now into North America. So what it is, it's just a different strain of COVID, and it unfortunately has a couple additional mutations on it. And that's what viruses do. They like to mutate, they like to change. And the more virus that's out in the community, the more likely it is to change. And we're learning more and more about Omicron. We don't have a lot of personal experience with it yet in the United States. But we do know that it is in multiple states. I think the last count that I saw was about 35 states. And it's now accounting for about 3% of all of our COVID infections.
So now when we look at this, when we look at Omicron, when you have people coming into the hospital, are they being tested specifically for Omicron? Do we know how many people have this, or is that too difficult to do?
As of right now, I do not know that a case has been identified in our region, especially in the Hazleton area. I have not heard of a case. That being said, we're not checking all patients that come in with COVID for the Omicron variant. The majority of cases are still the Delta variant. So we will continue to search for it, and the CDC does a good job of sampling the labs out of each state, and that's how they usually identify these cases pretty quickly. They kind of get a sampling of all the different labs across the state to get an understanding of how much Omicron is in the community. So right now, it's probably not here that much. We're still dealing with mostly Delta variant, but we do know that the Omicron variant does tend to spread more quickly, and we do know that that's something of concern. What we're hoping is that some of the rumors and the things that we've heard about it are that it might not be quite as severe as the Delta, and we're all keeping our fingers crossed that that's indeed the case. We just don't know yet.
How are things at Lehigh Valley Hospital Hazleton right now? Are you getting a lot of COVID patients still? Are things starting to wind down a little bit or not?
I wish I had better news to report, but unfortunately over the last 2 weeks, relatively since Thanksgiving, we've actually seen a really significant increase in our hospitalizations from COVID across the network. So whether it's in Hazleton, Pocono, our Schuylkill campus, Muhlenberg, and our Cedar Crest campus, we are all very stressed right now with both COVID infections and also other hospitalizations. So all of our systems right now are incredibly stressed. And I'm hearing the same reports from all of the other community hospitals too. So right now is really tricky. It's a really challenging time to be both a patient, a family member. We ask for everybody's patience. We're also dealing with a lot of staffing shortages. That's not just within our own network, that's across the board. So we're navigating that the best we can, trying to leverage other avenues of healthcare. So trying to leverage video visits when we can, trying to keep people out of the emergency rooms if they don't need to be there. So really, I encourage everybody, if you can, reach out to your primary care doctor, reach out to your urgent care, use video visits when appropriate. Try to do everything you can. If you don't feel like you need to go to the emergency room, try to stay away, but certainly they're there if you need them we don't want delay in care, but it is a struggle right now.
And is it the majority of patients that you are keeping in the hospital with COVID have not been vaccinated, or does that vary?
No, it's been pretty steady in that there's about an 80% of our patients in the hospital are unvaccinated, and an even much higher percentage of patients that are in the ICU and on the ventilator. I've seen upwards of 95 to 98% of those patients that are on the ventilator or in the ICU in our health system are unvaccinated. So we do know that there are more and more breakthrough infections, but meaning that a patient has had a positive COVID test after being vaccinated with two full dose vaccines. But the vast majority of those people are not getting severely sick and are not ending up in the hospital. So I think it's, I look at it as an attribute of how successful the vaccine is, even though it's potentially causing, you're getting COVID, you're not getting sick, you're not ending up in the hospital. And at the end of the day, that's what we wanted to do.
Today's news feature is brought to you by Frankie's Pizzeria and Restaurant in downtown Hazleton. For more information on their specials, hours, and where you can find their delicious tavern pizza, you can call 570-454-6000 or you can visit their Facebook page.